So operative mishaps that occur that lead to litigation come in two different categories. One is where something goes wrong in the operating room and the surgeons see it and try to deal with it. The second is when an error occurs in the operating room and the surgeon doesn't see it, doesn't know it happened, and the patient gets sent to recovery room and then hours later or days later has a catastrophic event. And we litigate both of those kind of cases. When the surgeon knows that an injury has occurred, sometimes that injury occurs because of a mistake the surgeon has made in surgery, carelessness that the surgeon has done, or done a technique in the wrong way, or used an instrument in the wrong way. Or sometimes it can be because there's a medical device issue that occurs that the surgeon is using and the surgeon has an issue with that. Let's say a machine that doesn't work properly and injures another part of the body that the surgeon is operating near. These kind of cases are very specific to what's in the operative record and to what's in sometimes the autopsy when you go and look and see what internally happened to the patient. I think these kind of issues having to do with context and operating room cases can be difficult, but the approach that we follow is, was the surgeon reasonable? And especially in an operating room context, was the surgeon operating in a safe manner? And the way we do that is we paint a picture for jurors of safety. Jurors have a general understanding of safety. They've worked in manufacturing jobs, they've worked in areas where there's lock-in, lock-out protocols. People have a understanding generally of safety. Surgeons, when they operate, have to follow certain safety standards. For example, if I, as a surgeon, blindly place a trocar through the abdominal wall and pierce a blood vessel or bowel, and I may be liable then for an injury that otherwise, if I had practiced in a safe manner and the injury had happened, I wouldn't have liability. So operating room litigation is about reasonableness and about patient safety, and were patient safety rules followed in the way the procedure was done.